Good morning. We are here with the Professor VANDENBRIELE from Herfield, and I have a question for you. What are the differences in treatment of acute myocardial infarction, cardiogenic shock, and acute decompensated heart failure, cardiogenic shock?
Well, thank you first of all for the question. That's a difficult question because they're both two complete different etiologies from cardiogenic shock. If there's an acute myocardial infarction and your patient goes into shock, they are not used to this. So this is a complete new situation for the heart, for the patient, etc. So the shock will be much more devastating probably in the acute myocardial infarction. And then the first thing, of course, is to treat the underlying etiology. You do PCI, or you try to solve the myocardial infarction to restore the oxygen for the myocardium. That's the first thing. But when that's not enough, or when the heart's not recovering immediately, you might need to give additional support. And then it depends on the severity of the shock. You can try with inotropies. If that's not enough, you can go for mechanical circulatory support, whatever the device is that you have available at your institution. But that's the first thing, and there are a few schools now telling that maybe inotropies do more harm than benefit, but others tell the same of the mechanical circulatory support, and that's still a debate and undergoing into trials. But that's for the first acute population. If you do have the acute and chronic decompensated heart failure, that's another population because their heart was already not normal and now there's an acute additional hit. So mostly the numbers you strive for, the numbers you want to treat for are different because the cardiac output was already impaired, etc. And then mostly we can get away with some minimal support like for a balloon pump or inotropies, and we less common go into mechanical circulatory support for that population, but it's also a possibility.
Okay, thank you, Professor, for being here with us and for the answer.
Okay, thank you, you're welcome.